Welcome to this edition of The District. I am Joan Garner, your Fulton County Commissioner for District 6. On March the 23rd, 2010, President Barack Obama signed into law the Patient Protection and Affordable Care Act, which provides several benefits for all Americans, including access to affordable health coverage and care. One major part of this act is the health insurance marketplace, where people will be able to shop for insurance coverage that fits their budgets and health care needs of their families. On today's show, we will be joined by Dr. Patrice Harris, Director of the Fulton County Department of Health and Wellness, Natalia Callis, Executive Officer, Office of the Regional Director, U.S. Department of Health and Human Services, and John Haupert, President and CEO of Grady Health System, to discuss the Patient Protection and Affordable Care Act. We have a great show planned. Don't go away. We'll be right back. Welcome back to the District. We have a great show planned for you today. I am Joan Garner, your Fulton County Commissioner for District 6. Joining us today is Dr. Patrice Harris, Director of Fulton County Department of Health and Wellness, Natalia Callis, Executive Officer, Office of the Regional Director, U.S. Department of Health and Human Services, and John Haupert, President and CEO of Grady Health Systems. Dr. Harris, Natalia Callis, and John Haupert, great to have you on the District. Thank you so much for being here today.
Thank you for having us.
So, Dr. Harris, let's start this conversation today with you. Some of the insurance-related provisions of the Affordable Care Act, or ACA as we so fondly know of it, became effective immediately upon or shortly after the passage of the law. So what are some of the provisions and how do they benefit the residents of Fulton County?
Well, Commissioner Garner, that's a great question because I think in the midst of the healthcare exchanges, we forget that there were some benefits that went into effect immediately. One important benefit was that insurance companies couldn't deny coverage based on a pre-existing condition. Many times before, if you had a previous illness, you might either have to pay a lot more for insurance out there on the open market, or you couldn't get insurance at all. A company would turn you down. And so with the Affordable Care Act, insurance companies were no longer able to do that. And something that I don't think a lot of our women listeners would probably know, that women had to pay more oftentimes for insurance out there on the open market. And of course, with the passage of the Affordable Care Act, that was no longer allowed. What about the provision where students and children could stay on their parents' insurance until they were 26? That was oftentimes a coverage gap for those who had gone to college, weren't working, or those who had just graduated college but perhaps had not been able to get health insurance. So now young folks can stay on their parents' insurance till they are 26. So those were just a few of the many benefits that went into effect immediately soon after the passage of the act.
Good. So the 2012 U.S. Supreme Court decision on the constitutionality of the ACA made Medicaid expansion in each state optional. So according to the Kaiser Family Foundation, Georgia is one of 21 states not moving forward with Medicaid expansion at this time. So how has Georgia's decision to not expand Medicaid impacted Fulton's residents and who are currently uninsured?
Well, certainly without the expansion of Medicaid, those folks who were hovering around 100 to 133% of the federal poverty level will not be able to get a health insurance through Medicaid expansion or the health care exchanges. Those are clients that we normally see in many of our Fulton County clinics. We see a significant number of uninsured clients that would be eligible had the state of Georgia decided to expand Medicaid. So they won't be covered under Medicaid, but we do want to make sure that our citizens know they can still come to us any one of our Fulton County clinics and still receive some of the services that we offer. And we particularly partner with two partners, Grady at our Sandy Springs Clinic and the West End Medical Centers at our Neighborhood Union Clinics and the Adamsville Regional Health Centers. And they provide primary care services. So they can still come to our centers and receive some services based on a sliding fee scale.
Okay, so will Georgia's decision not to expand Medicaid affect those who are currently covered by Medicaid?
No. If you already have Medicaid or insurance for that matter, the Affordable Care Act really won't have any negative impact. In fact, the impacts are positive. And so a lot of people are worried about that. Well, I already have coverage, and is this going to negatively impact my coverage? So if you already have coverage, you won't see much of a change.
Thank you, Dr. Harris. That's very important information that I think our residents really need to know. So that leads me to my next question, and that's you, John. Welcome to the show.
Thank you very much.
It's great to have you here. So, John, how will Georgia's decision not to expand Medicaid impact Grady Health System?
Well, just like the county, we provide care to a number of individuals who are either uninsured, underinsured, or can't gain access to health insurance. And so it rules out those people below 135% of the federal poverty level from having access to much needed health care insurance. We estimate that in Fulton County alone, of the Fulton County patients we currently see, there's approximately 23,000 Fulton County residents who would gain access to health insurance if Medicaid were expanded in the state.
Wow. So what are Medicaid disproportionate share hospital, fondly known as DISH, payments, and how do they support the Grady Health System and other safety net hospitals?
Sure. Medicaid disproportionate share is a program that was put in place by the federal government to make sure that hospitals like Grady and hospitals that provide significant amounts of care to Medicaid patients or to uninsured patients, that we're able to survive on a Medicaid payment rate. And so it's additional funds that flow from the state and the federal government to help provide that care. And so under the Affordable Care Act, an interesting thing happens. The original intent in the Affordable Care Act was to use some of that funding to help fund the expansion of Medicaid, which made perfect sense. You lose funding on the right hand and you gain funding on the left hand. Mm-hmm. But what we find ourselves facing now is that Grady stands to lose $45 million a year in funding from the disproportionate share funding being reduced, but there's no offset on the other side, which would have been Medicaid expansion.
Yes. Thank you. Thank you, John. Ms. Callis, welcome to the show.
Thank you.
How can Fulton County, specifically the Fulton County Department of Health and Wellness, best support implementation of the provisions of the Affordable Care Act?
I think, like Dr. Harris stated, having the partnerships with existing organizations that are working on the same efforts of the Affordable Care Act, in particular for the marketplace, providing additional services would be great. In addition to that, also helping to navigate some of those folks who potentially could qualify for the marketplace, get connected to be enrolled in the marketplace. As some people may not know, federally qualified health centers like the West End Medical Center and some other federally qualified health centers around the county have received some additional funding to enroll folks in the marketplace as well, and also to connect them to additional services like the Fulton County Health Department for additional services if they don't qualify for the marketplace. So I think, continuing to offer the same services that they have, the partnerships they have, and then also just bridging that gap of getting people enrolled would be a great help to the department, in addition to connecting with the navigators and then the certified application counselors as well.
Great. So what are the key provisions of the Affordable Care Act that will lead to improvements in the quality of health care for Americans?
Like the panelists have said, I think, continually to continually to educate them, around the PSIP provisions. Also to connecting folks to the marketplace would help bridge the gap of the uninsured, those who may not qualify for Medicaid expansion, but those who qualify for the tax credits that will be afforded to them. Also getting people educated around children being able to stay on their parents' insurance and or catastrophic plans that will be issued to those who are in that gap between age 26 to 30 who may not have insurance as well. Those are lower premium plans that will be offered that offer some preventive benefits as well. Also letting people know who have existing insurance that the preventive screenings have been also covered in the Affordable Care Act as well, with no co-payments and some low-cost cost sharing. So that would be a great advantage as well.
Great, thank you. Thank you, Dr. Harris, Ms. Callis, and John. When we return, we will continue our discussion about the Affordable Care Act with Dr. Patrice Harris, Director of the Fulton County Department of Health and Wellness, Natalia Callis, Executive Officer in the Office of the Regional Director for the U.S. Department of Health and Human Services, and John Haupert, President and CEO of Grady Health System. You are watching The District. Stay tuned. There is more to come. Welcome back to the District, everyone. I am Joan Garner, your Fulton County Commissioner for District 6. If you just tuned into the show, we are having a discussion about the Affordable Care Act with Dr. Patrice Harris, Director of the Fulton County Department of Health and Wellness, Natalia Callis, Executive Officer in the Office of the Regional Director for the U.S. Department of Health and Human Services, and John Haupert, President and CEO of Grady Health System. Welcome back to the show, everyone. Dr. Harris, before we took the break, Ms. Callis was explaining the key provisions of the Affordable Care Act that will lead to improvements in the quality of health care for Americans. Though Medicaid expansion is not happening in Georgia, health insurance exchanges will. What is a health insurance exchange, and how will it benefit Fulton County residents?
Well, hopefully our Fulton County residents are hearing a lot about these exchanges, or they may hear about the marketplace. They're the same thing, but it really is an opportunity for our citizens to shop for. I almost think about a supermarket, to go in, look on the shelf, and pick the items, the type of insurance that works best for an individual or their family, and that means working best for their pocketbooks, regarding the monthly premiums, the co-pays, and the deductibles, but also their health care needs. And so that's the exchanges in a nutshell. And again, hopefully everyone is beginning to gather all the information that they need, because open enrollment starts pretty soon.
So how will Fulton County residents who are currently uninsured be made aware of the new insurance coverage options available through the exchanges?
Well, I can tell you what we're doing with Fulton County, and we, as you know, are doing this show. Several of the commissioners and your colleagues have been having town hall meetings. We've been posting flyers at all of the county facilities. We've been sending information out via email to many of our community partners. So we have just been working with the navigators, for instance, the Center for Black Women's Wellness. They are already a partner with us in health and wellness, and they were one of the groups that are part of the coalition that got a grant to be a navigator. So it's about the partnerships and getting the information out so that our citizens know when to sign up and what to be prepared for as they sign up.
Great, thank you. Thank you, Dr. Harris. Ms. Callis, in addition to the health insurance exchange and the insurance subsidies for eligible individuals, what are some of the other aspects of the Affordable Care Act that will increase access to overall health care?
Well, in the marketplace, getting the premium tax credits to purchase insurance will offer some assistance as well for consumers. The tax credits will provide the additional funding that some families would need or individuals would need. In addition to that, within the marketplace, there will be qualified health plans that will be offered. Those are certified insurance products or issuers that will provide those services so that folks can have insurance. And then within that, you have the essential health benefits that all of the plans will have to offer. And within those essential health benefits, it covers 10 aspects from pediatric services to maternity services. An important piece of that is the preventive screening and services, also prescription drug coverage, which before, when people were in the open market, they weren't able to have all of those services all together or bundled together for one low cost. And a lot of those things weren't covered. So now folks having access to the marketplace to get those qualified health plans and also to have access to the essential health benefits will be great for citizens to increase the overall health and well-being.
Great, thank you, Ms. Callis. John, under the Affordable Care Act, Medicaid disproportionate share hospital, DISH, if I could call it DISH, payments will be reduced beginning in 2014 due to the assumption that under Medicaid expansion and the health insurance mandate, fewer uninsured individuals would be accessing safety net hospital care. However, since Georgia is not expanding Medicaid, the decrease in the number of uninsured will not be as significant as originally projected. So how might the mandate reduction of DISH payments impact services provided by Grady?
Well, clearly we, Grady, as a safety net hospital and the other safety net hospitals around the country are spending a lot of time right now lobbying to preserve those DISH funding payments, particularly in the states that aren't expanding Medicaid, because we really are concerned that the safety net health providers are in place for the people who need us when they need us. So what that means, if we're not able to do that and we lose the funding I spoke of, $45 million a year, we will have to look at reducing the services we can provide to the community. And while we've not identified exactly what those services would be, it would be a definite action that we would have to take to reduce the amount of clinical services we can provide. There's no way for us to sustain a $45 million reduction in funding and be able to offer everything we do today.
Well, as you know, Congressman John Lewis recently introduced the DISH Reduction Relief Act, which would delay DISH funding cuts until 2016. How will DISH Reduction Relief Act help Grady and the patients Grady serves?
Congressman Lewis's legislation would assist us as well as all safety net hospitals with retaining that funding, critical funding that we need to continue to provide services to the uninsured and underinsured. Without that, we would see those cuts go into place in 2014. The President himself, though, has also recommended in his budget this year that the DISH cuts be postponed a year. And so we're waiting to see if Congress approves his budget to see if that will happen. But those two things combined will give us some time to continue to have the discussion about how we retain that vital funding for safety net hospitals.
Great, thank you. So, Ms. Callis, my last question is for you. Open enrollment in the health insurance market exchange begins on October 1, 2013, which with coverage beginning on January 1, 2014. What insurance options will be available through the insurance exchanges?
Well, there'll be a variety of issuers that will be offered in the marketplace. Essentially, if they, a consumer would go into the marketplace, pick which plan will work best for them, especially for their pockets, their family size, figuring out what tax credit they would have. Also, there will be 4-level plans that will be silver, gold, platinum. Silver, bronze, gold, and platinum. And those plans will be offered just based on the co-payment options, the cost shares, deductibles, and so on. So depending on what a family or individual feels will best suit their needs health-wise and then also their pocketbooks, then they can choose those plans and go forth. On October 1st, those health insurance issuers or health insurance companies will be up and running to offer those products in the insurance marketplace. And also open enrollment goes until March 31st of 2014. So you you have a 6-month window. We're encouraging those who want to get covered by January 1, please get with someone and get enrolled by December 15th
Great.
as well.
Thank you very much. Dr. Harris, Ms. Callis, John Haupert, thank you so much. When we return, I will share my closing thoughts. We'll be right back. Welcome back to the district. I am Joan Garner, your Fulton County Commissioner for District 6. Today we discussed the Affordable Care Act with Dr. Patrice Harris, Director of the Fulton County Department of Health and Wellness, Natalia Callis, Executive Officer in the Office of the Regional Director for the U.S. Department of Health and Human Services, and John Haupert, President and CEO of Grady Health System. Starting on October 1st, everyone will be able to shop in the health insurance marketplace online, similar to how we shop online for our favorite clothes, shoes, and electronics. For people who do not want to shop and apply for insurance online, there will also be paper applications available where health insurance navigators will help families apply for insurance coverage and choose the best options. The marketplace can be explained in 4 simple steps. 1, create an account. 2, apply. 3, pick a plan. And 4, enroll. Health insurance coverage can begin as soon as January 1, 2014. If you already have existing health insurance that you are not satisfied with, then you can continue to use your insurance provider. If you are uninsured or underinsured, the health insurance marketplace will provide many options to help provide coverage for you and your family. I want to thank my guests for the helpful information they provided us today, and thank you for joining us on the district. That's our show for today. Feel free to contact my District 6 office anytime by calling us at 404-612-8226. You can email us at district6@fultoncountyga.gov, tweet with us at ComJoanGarner, and of course, friend us on Facebook. Until we meet again, I am your District 6 Fulton County Commissioner, Joan Garner. Thanks for watching The District.